different approach to the conversation that we started having today. And what I'm going to do is start by telling you 3 stories of patients. And I use patients in this case because in this case, as you'll see, these people were patients, not healthcare consumers. The first case is a patient named Jerry, who is in his early 40s and is a mechanic. He goes to his doctor because of chest pain, so he says. But when you ask him more about what his chest pain is, he says that he's been moving boxes over the weekend, and he was sore all over in his body, sore in his muscles, and his legs, and in his arms, but also sore in his chest. His doctor, of course, hears chest pain and says, well, we gotta send you to the ER. So he goes to the ER to get checked out, and in the ER he gets blood drawn, he gets x-rays, he gets EKGs. He gets told he has to stay overnight to make sure he's okay. So of course he says, I have to stay overnight. And in the morning he gets more blood work done, more EKGs done. He then runs on a treadmill, and at the end of all of that, the doctor says to him, congratulations, you don't have a heart attack, you don't have pneumonia, you have chest pain. You with chest pain. Why is it that I'm leaving the doctor with fewer answers than what I came in with? So story number 1. Story number 2 is of a woman named Danielle, 21 years old, just turned 21. She and her roommate are college students. They went out celebrating, because they wanted to have some cakes and celebrate their 21st birthdays. So the next morning she wakes up and she has this terrible pounding headache. And you tell anyone this and they'll say, well, she has a hangover, right? Her mouth feels dry, she feels lightheaded. But she lives out of, or her parents live out of town. She doesn't have a doctor in the state. And so her mom gets worried, but she calls her mom and says, just go to the doctor and get checked out. And so she goes to the local emergency room. And in the ER, the doctor hears she has the worst headache of her life. And so says, we need to get a CAT scan, and we have to do a spinal tap to make sure you don't have a bleeding of brain or meningitis. And Danielle really feels trapped. But she doesn't know. She doesn't want to go against what the doctor orders. But she also doesn't think that she really needs all this to be done, right? Well, what could she really do to speak up for herself in that moment where she feels so disempowered and so scared and already not feeling well as part of her care? Story number 3 is of a woman named Sandy, who's in her late 40s and is a school teacher. And she goes to the doctor because of several months now of just not feeling well, feeling run down, needing a bit more short of breath, coughing all the time. And her doctor says, well, you're a school teacher, you're exposed to kids who are sick all the time. Don't worry, I'm sure you just have a virus. So she says, okay, I don't think that's what I have because this has been going on for so long and I know my own body. But she doesn't really know how to speak up to her doctor. She's an immigrant also, has another cultural barrier to seeking care. And so she doesn't want to speak up, so she goes home and sees if she'll get better. A few months go by, and she says, but I don't feel any better. She goes back to the doctor. The doctor says, well, let's run some tests. We don't know what tests she had done, but she got some tests done. These tests apparently were negative. And so the doctor says, oh, you're fine. You're just depressed. And so prescribes her some Prozac. A couple months go by, she still doesn't feel any better, goes back to the doctor. The doctor says, well, now you are anxious, so you need to do some Valium. Basically, it's not until a year later that she's finally diagnosed with breast cancer that's widely metastatic. Metastatic to her brain, to her lungs, to her liver, and to her bones. Now, I tell all of these stories not because I think medicine is bad, or doctors are bad, or hospitals are bad, or anything else, but rather that there are so many different issues in our healthcare system, right? In the panel earlier, we saw, I think, a very good picture of the complexity of the problems. I raised these cases also to mention that really more isn't better, but also less isn't better either. In the case of Jerry and Danielle, they went to the doctor wanting answers, but instead they got unnecessary testing. They got doctors who didn't listen to them, and they ended up feeling very trapped and not really knowing where to turn next. And this is not just wasteful. We know that 30% of all healthcare costs is waste. That's $700 billion a year spent on unnecessary tests and unnecessary treatments. That's crazy. But it's not just that we're spending too much money. It's also that unnecessary tests have unnecessary complications. They lead to more things being done to you. And also that if you don't have the right test done, you're going to get misdiagnosed. of the 100,000 medical errors made every year, we know that the majority of them are due to errors in diagnosis. And so if you don't get your diagnosis right, that could lead to seriously fatal consequences too. And so, what is there to be done, right? I mean, sometimes when I speak to medical groups, people will give me all these answers of saying, these doctors will say, well, there's nothing to be done, the system has to change. And I certainly agree that the system has to change, and we have to get the right incentives in place. And so many of you in this room are working on changing the system. That's absolutely critical. But I also believe in the quote by Tip O'Neill, that all politics is local, and in the corollary, that all medicine is personal. And I believe that everything has to start with change on the individual level, between the individual provider and the individual patient. That is where change has to occur in order to make change on a more global or national level. And so specifically in my book with Dr. Stone Listen, I talk about this partnership, a partnership to become a pushy patient, as was said earlier, but the partnership really to empower yourself. Right, to empower yourself as a healthcare consumer, to empower yourself as a patient, whatever terminology you like to use, but specifically to become an equal partner in the relationship between you and your doctor. That's the most critical part. You cannot go into your doctor and feel like, well, everything the doctor says I have to do. Or I can't ask my doctor about costs, I can't ask my patient about this. You have to feel like you can be empowered, and in fact you should be empowered. One way to think about this is to say, the doctor may be the expert when it comes to medicine, but I'm the expert when it comes to my body. I'm the expert when it comes to when I'm a caregiver, I'm the expert when it comes to my family member and their loved one. And to that extent in my book, I offer several tips about how to do this, but I would say the 3 major tips I have is, first of all, to make sure you tell your story. Make sure your doctor hears your story. We actually know based on studies that 80% of diagnoses can be made just based on your story. That's remarkable. And that means that if you don't tell your story and instead you spend all this time on tests and other things, that the doctor's going to miss your story altogether. So make sure you tell your story. The second tip is to aim for your diagnosis. Just being told that you have chest pain is not sufficient, right? Just being told that you have a headache or that you don't have something, that's not a diagnosis. You have to find out what your doctor's thinking. Maybe they don't know 100% sure, but make sure you find out, you have some idea of what it is your doctor is thinking. Because otherwise, there's no point to getting any test done, unless you know what specifically you're getting tested for. The third tip is to ask about every test and every treatment. And in a way, this seems very intuitive, but how many of you, when your doctor says to you, we need to get some blood work, do you actually say, what blood work? What exactly are we looking for? And how is this going to change my management? We ask that for surgeries. If you're going to have surgery, of course you're going to be asking what's the alternative, what are the side effects, what are the risks, can I wait? But you'll ask these questions. But also ask these questions when it comes to testing. Testing is very expensive, but also leads to more. And actually, I want to go back to our 3 stories of Jerry, Danielle, and Sandy for a moment. So Jerry, the guy who came in with the chest pain and lifting boxes and actually really just on a muscle strain, but went through all these tests. So a few weeks later, he has chest pain again. And he's still worried, right? Because he never knew what he had to begin with. He doesn't know that this is a muscle pull. He just gets told it's chest pain. So he goes back to his primary doctor, and the primary doctor says, well, you still have chest pain, so I need to refer you to a cardiologist. And I apologize to the cardiologists in the audience, or to the specialists in the audience. But there is a saying in medicine that when you're a hammer, all the world's a nail. And so the cardiologist says, well, I think this has to be your heart, and so orders a catheterization for Jerry. And so Jerry goes to the catheterization. The good news is there are no blockages in his arteries in the heart. He's fine. However, in the course of the catheterization, he ends up getting an aneurysm, he ends up getting pneumonia, he ends up getting urinary tract infections. He ends up being fine at the end of all of this, and he recovers and is now totally fine. But is he really so lucky after all? Or did he have unnecessary tests done that really actually caused him significant morbidity and unnecessary risk? And he still doesn't know what he has. In the case of Danielle, the college student, she gets so freaked out, for lack of better words, that she goes to the bathroom, takes off her hospital gown, all the leads that are attached to her, rips off her ID, and now there's this big pool of blood on the ground. she jumps out the window. It's a first floor bathroom, so she's totally fine. And we might be able to argue that maybe she did the rational thing, and that maybe she avoided the CT scan, and she didn't need to stuff the out. Maybe this was the right thing to do, but is that really the ideal healthcare system? In which people are so scared, right, that they feel like the only way out is to jump out the window. Not ideal medical care. And in the case of Sandy, the school teacher, well, she's the reason I do what I do, because Sandy was my mother. And I was a medical student when she began telling me about all these symptoms that she was having. I was a second-year medical student, actually, and I was in Missouri, at Washington University, studying, and she was back home in California. And she would call me and tell me about these symptoms, and I knew something wasn't right, because she wasn't a complainer. You know, she wasn't someone who would ever call me to say, I'm not feeling well. She was an immigrant and worked really hard, and I knew that if she was complaining about something happening, that it must be really bad. And I kept on asking her, you have to tell your doctor this, and I would go with her to the doctor's appointments. But she would specifically say to me, right before we saw the doctor, don't bring it up. She was so afraid that the doctor would somehow react negatively, or would say something, or would treat her not so well if she advocated for herself. And I did what she asked for, because that's what she wanted. But don't think that every day I reflect on this and think about how different things would have been if I had spoken up for her, if I had spoken up with her or encouraged her to speak up. And maybe nothing would have been different. I mean, who knows, right? But maybe it would have. And that's the reason I do what I do. That's the reason I think that being an empowered patient is absolutely critical, right? Or being an empowered healthcare consumer is so critical. Because if you don't speak up for your health, nobody else is going to. And apparently our healthcare system, unfortunately, as I've learned in the course of taking care of my mother during her illness, I learned that our healthcare system is not set up for patients. It's set up for doctors, it's set up for nurses, it's set up for perhaps for insurance or in hospitals, but there's a big disconnect between what is best for patients and what is best for everyone else. And we have to figure out a way to align these incentives so that you as an individual patient can get the best care possible. And so this is the reason why I wrote with Dr. Stoneless, and this is the reason why I consider myself to be both a physician and patient advocate. Because I do think that it requires both of these parties, if you will, coming together, and all of us coming together in order to make meaningful change. And so I want to allow enough time for questions and a robust discussion. And I do want to again commend all of you for being here, and again the organizers for putting together such a robust panel and a group of participants. And I really want to just say also that it's only with all of your help that we can really make a difference, and change has to start with all of us today. So thank you all very much. I'm very happy to take questions now.